Over 300 patients died at the hands of a single nurse, a man who was supposed to be their caretaker and protector, Charles Cullen. Cullen, dubbed the Angel of Death, was a registered nurse who used his position to commit unthinkable acts. He worked in hospitals and healthcare facilities across New Jersey and Pennsylvania. For over 16 years, he preyed on vulnerable patients, often those who were already in critical condition. Injecting them with lethal doses of drugs, Cullen's method was both calculated and cold. He would administer medications like digoxin, insulin, and epinephrine in amounts that would cause fatal overdoses. His case shocked the nation, exposing terrifying flaws in the healthcare system and raising serious questions about patient safety. How could such a person go undetected for so long? The investigation revealed a series of missed warnings and ignored red flags. It's a story about the violation of trust, the fragility of life, and the devastating impact one individual can have on countless families. The fear and uncertainty that Cullen instilled in the hearts of patients and their loved ones cannot be overstated. This chilling tale underscores the urgent need for greater vigilance in protecting the most vulnerable members of society. It calls for stricter oversight, better communication among healthcare providers, and a commitment to ensuring that such a tragedy never happens again. Cullen's story is a haunting reminder of the dark side of human nature and the critical importance of trust in the healthcare system. Charles Cullen was born in West Orange, New Jersey in 1960. His childhood was marked by tragedy and turmoil. He was the youngest of 8 children in a working-class family. Cullen's father, a bus driver, died when Cullen was just 7 months old. Cullen described his childhood as miserable. He was bullied and struggled to fit in. As a teenager, he began to exhibit signs of mental instability. He attempted suicide multiple times. Despite these challenges, Cullen graduated high school and enrolled in nursing school. In 1987, Cullen began working as a nurse in the burn unit of St. Barnabas Medical Center in New Jersey. It was here that he committed his first murder. Over the next 16 years, Cullen would go on to kill dozens, possibly hundreds of patients in 9 different hospitals across New Jersey and Pennsylvania. He blended in seamlessly, appearing as a quiet and unassuming healthcare professional. However, behind this facade lurked a cold and calculating killer who used his access to powerful medications to end the lives of those entrusted to his care. Cullen's killing spree was not confined to a single institution. Throughout his career, he moved from one hospital to another, often leaving under a cloud of suspicion. He was fired from 5 hospitals and resigned from 2 others before being investigated for his crimes. Each time Cullen changed jobs, he left behind a trail of unexplained deaths. However, a lack of communication between hospitals and a reluctance to investigate suspicious deaths allowed him to continue his killing spree for far too long. Section 5. Methods of murder. Cullen's weapon of choice was medication. He typically injected his victims with lethal doses of drugs, often using insulin or digoxin. These drugs were readily available in hospitals, and their effects could be difficult to detect, especially in patients who were already critically ill. He chose his victims seemingly at random, often targeting patients who were elderly, weak, or close to death. Cullen believed he was relieving their suffering, but his actions were those of a cold-blooded killer who acted with chilling premeditation. Section 6. Systemic failures. The case of Charles Cullen exposed a number of systemic failures in the healthcare system. Hospitals were often reluctant to investigate suspicious deaths, fearing negative publicity or lawsuits. Additionally, there was a lack of communication between hospitals, which allowed Cullen to move from one institution to another without raising red flags. Cullen's case highlighted the need for better background checks for healthcare workers, improved tracking of medication errors, and stronger whistleblower protections. Section 7. Impact on families. The families of Cullen's victims were left devastated by their loss. Many felt betrayed by the healthcare system that was supposed to protect their loved ones. They struggled to comprehend how a serial killer could operate within hospitals for so long undetected. The families of Cullen's victims have shown immense strength and resilience in the face of unimaginable tragedy. They have channeled their grief into advocacy, pushing for reforms to prevent similar tragedies from happening in the future. Section 8. Capture and Confession. Charles Cullen was finally apprehended in December 2003 thanks to the tireless efforts of detectives who had been on his trail for months. The arrest was a culmination of a painstaking investigation that involved piecing together a complex puzzle of mysterious patient deaths across multiple hospitals. The breakthrough came when a courageous nurse, who had long harbored suspicions about Cullen's involvement in a series of unexplained deaths, decided to come forward. Her cooperation was instrumental in providing the detectives with the evidence they needed to make an arrest. Once in custody, Cullen confessed to killing 40 patients, a shocking admission that sent ripples through the medical community and beyond. His confession was not just a moment of reckoning for the families of the victims, but also for the healthcare institutions that had unwittingly harbored a serial killer. Experts, however, believe that the true number of his victims could be much higher, possibly reaching into the hundreds. This grim possibility has left many questioning how such a tragedy could have gone unnoticed for so long. In 2006, Cullen was sentenced to 11 consecutive life terms, ensuring that he would never walk free again. The courtroom was filled with a mix of relief and sorrow as the judge delivered the sentence, bringing a sense of closure to some but not all of the affected families. Cullen will spend the rest of his life behind bars, a fate that many believe is too lenient given the magnitude of his crimes. His imprisonment, however, guarantees that he will never have the opportunity to harm another patient again. The cold, unyielding walls of his cell serve as a stark contrast to the lives he took, lives that were full of potential and abruptly cut short by his actions. However, the scars of his crimes run deep, affecting not just the families of the victims but also the broader community. The emotional and psychological toll is immeasurable, leaving a lasting impact on all who were touched by this tragedy. This case serves as a chilling reminder of the vulnerability of patients within the healthcare system. It underscores the need for rigorous oversight and the importance of creating an environment where healthcare professionals feel empowered to speak up about their concerns. The vigilance of healthcare workers is crucial in preventing such tragedies from occurring in the future. It is a collective responsibility to ensure that the sanctity of patient care is upheld and that trust in the healthcare system is restored and maintained. Section 9. Aftermath and Legacy. The case of Charles Cullen had a profound impact on the healthcare industry. His actions, which spanned over a decade, left an indelible mark on the medical community and the public's trust in healthcare institutions. It led to the implementation of stricter patient safety regulations. Hospitals and healthcare facilities across the nation began to reevaluate their protocols and procedures, ensuring that patient safety was prioritized above all else. This tragic case also increased awareness about the importance of reporting suspicious activity. Healthcare workers were encouraged to speak up if they noticed anything unusual, fostering a culture of transparency and vigilance. Hospitals now conduct more thorough background checks on potential employees. This includes not only verifying credentials, but also looking into any past employment issues or red flags that might indicate a potential risk. Additionally, stricter protocols for medication administration have been implemented. Double-check procedures and more rigorous oversight ensure that medications are administered safely and correctly. Cullen's crimes exposed a dark underbelly of the healthcare system, revealing vulnerabilities that shocked the nation. The public was horrified to learn how easily a trusted professional could exploit the system. This revelation led to a nationwide conversation about the need for better oversight and accountability in healthcare. People demanded changes to ensure that such a tragedy could never happen again. Although no amount of reform can fully erase the pain and suffering he inflicted, the memory of the victim serves as a powerful reminder of the importance of these changes. Families who lost loved ones continue to advocate for patient safety and justice. The changes implemented in the wake of his capture serve as a testament to the enduring commitment to patient safety. Hospitals now invest more in training and education, ensuring that staff are well equipped to handle any situation. The pursuit of justice for the victims continues to be a driving force behind these reforms. Candlelight vigils and memorials are held to honor those who lost their lives, reminding us all of the importance of vigilance and accountability in healthcare.